Thank you. And nurses will go on a nationwide strike on the 1st of October unless the government grants them at least 90,000 shillings in allowances and permanently employ those on contracts. This new development presents a quagmire in the health sector as doctors and registrar doctors insist that they will not return to work until self-sponsored doctors are paid call and extraneous allowances and the Musimi Task Force report of 2012 is implemented.
The newly formed Kenya National Union of Nurses has presented Treasury with yet another headache.
The strike notice given to the government is set to commence on 1st October 2012.
Union leaders announced the intended October 1st strike in solidarity with nurses at the Moi Teaching and Referral Hospital who have been on strike for 3 weeks now. Officials of the referral hospital have asked the nurses to report back to work by Wednesday, the 19th of September.
The industrial action and the strike continues.
The industrial action comes with a list of demands, the first being a certificate of registration for the union which was formed earlier this year.
We are asking the government to immediately pay all nurses, all Kenyan nurses, 30,000 shillings, between 30,000 and 65,000 shillings in non-practice allowance. We are also asking the government to pay all nurses call allowance of Kenya shillings 30,000, a flat rate, to all nurses in the country.
Going by the demands, a nurse should earn about 90,000 shillings in allowances.
We immediately ask the government to stop the planned National Health Insurance Fund deductions, new deductions. We are saying that if those deductions are going to be implemented, the already poor working nurses cannot sustain their daily living.
At the Moi Teaching and Referral Hospital, the situation is deteriorating. Nurses sit outside the hospital while patients fend for themselves. The government is hard-pressed to respond to the crisis presented by medical workers. Doctors and registrars are on the streets demanding allowances and the implementation of the Musimi Task Force report of February 2002. This report compels the government to improve the current public health care system. The Minister for Medical Services, Professor Anyang' Nyong'o, and the management of the Kenyatta National Hospital have given doctors and registrars until Friday to report back to work, after which their medical licenses will be reinstated. However, it would seem the government conditions are being ignored by the medical practitioners. Catherine Omwando, KTN.